For our first community conversation, we're joined by Dr. Michael Stye with Sentara Family Medicine at 5th Street Station. He's sitting down with Aaron.
Dr. Stye, thanks for coming in today. It's great to have you here.
Thank you for having me. I appreciate it.
You're very welcome. So you're here today to share some health tips about tick bites. And those are more prevalent this time of year, correct?
Definitely. Even in the past week or two, we're seeing a lot more exposure and a lot more people getting bites and then having complications from that. So this was a really well-timed segment, I think.
Absolutely. So let's start with the basics. What should someone do if they find a tick on themselves or a family member?
Well, I wouldn't delay in taking it off. I would probably put that as a priority and get that off as quick as you can. Usually a nice pair of fine tip tweezers at home would do a nice job. Use your tweezers and get right to the base of your skin. Grasp a tick close to the head if you can, and pull straight upwards. Don't use twisting kind of motions. Don't move it around. Don't put rubbing alcohol or Vaseline on it or other things. Just try to get that off right away.
Okay, with tweezers.
Correct.
Gotcha.
If they're available. If not, some fingernails will do the trick too.
Okay, gotcha. And then what are some signs or symptoms to watch for after a tick bite?
Yeah, definitely there can be some localized itching, and that's not much of a concern, but if you see the development of a larger, broader red rash, that would be important. Fever, body aches, headaches, those things should probably alert you to seek medical attention and figure out what's going on.
Gotcha. And then when should someone make an appointment to see their doctor after a tick bite?
Yeah. Again, I think if you're able to remove it when it's not engorged or not filled up with blood, that's a much less risky situation. If it's been attached to you for 36 or more hours and you're able to pull it off, you should probably be more vigilant about watching your symptoms and make an appointment for further evaluation.
And are there ways to prevent tick bites, especially during outdoor activities?
Definitely. Ticks really like wooded areas, areas with a lot of brush, tall grass. So if you're going to venture out in those areas doing things like hunting or hiking or just playing around outside, you're going to want to wear a insect repellent with DEET in it. Consider if you're going to be out for a long time, getting permethrin on your clothes, long sleeves, long pants, tuck your pants into your shoes, and then when you're done with your activity, come back inside, do a tick check. They like to hang out in places around your hairline, behind your ears, under your arms, your groin, behind your knees. So do a tick check afterwards.
Okay, that's good to keep in mind for sure. And then if anyone has any further questions, how could they contact you or anyone else at Sentara Family Medicine?
Well, they would call the main hospital number, or at our clinic at 5th Street Station, we're 654-1800.
All right, great tips there. Thank you so much, Dr. Stye, for coming in.
Thank you for having me.
You're very welcome. Steve, over to you.